Today, I'd like to discuss an important and serious health issue that affects millions of people worldwide, which is HIV, or human immunodeficiency virus. I am Mary Joy Marasigan, second-year nursing student from LaSalle University. What is HIV? HIV is a human immunodeficiency virus. It is a virus spread through body fluids and affects specific cells of the immune system, called CD4 cells or T cells. A virus that kills the CD4 cells, T cells, damaging the immune system. A virus replicates inside the human body, so it must invade a healthy cell in the body to survive. Here's a simplified explanation of the key steps involved in HIV pathophysiology. First, entry and attachment. HIV enters the body through contact with infected bodily fluids. Fusion and entry. The virus fuses with the host cell membrane, allowing its genetic material, in the form of RNA, to enter the host cell. Next would be reverse transcription. Once inside the host cell, the viral RNA is converted into DNA by the action of reverse transcriptase, an enzyme carried by the virus. Replication and viral protein synthesis. The integrated viral DNA is transcribed and translated by the host cell machinery. Release and spread. The newly formed viral particles are released from the infected host cell and can infect other. The signs and symptoms of HIV can vary from person to person and can change throughout the different stages of the infection. It is important to note that during the early stages of HIV infection, some individuals may not experience any noticeable symptoms. However, as the infection progresses, the following signs and symptoms may occur: headache, fever, chills, night sweats, swollen lymph nodes mainly on the neck, sore throat, muscle aches and pain, joint pain, fatigue, mouth ulcers. After the initial symptoms, some individuals may not experience any noticeable symptoms for several years, even though the virus is actively replicating in their bodies. Several factors increase the risk of HIV transmission. These include unprotected sexual intercourse. Engaging in vaginal, anal, or oral sex without using condoms or other barrier methods can increase the risk of HIV transmission, especially if one of the partners is HIV positive. Sharing needles or syringes. Injecting drugs and sharing needles, syringes, or other drug paraphernalia can lead to HIV transmission if the equipment has been contaminated with infected blood. Maternal-fetal transmission. An HIV-positive mother can transmit the virus to her child during pregnancy, childbirth, or breastfeeding. Blood transfusions and organ transplants. Although rare in countries with robust screening processes, receiving blood transfusions or organ transplants from HIV-positive individuals can pose a risk of HIV transmission. Occupational exposure. Healthcare workers or individuals in occupations where they may come into contact with HIV-infected blood or bodily fluids are at a higher risk of acquiring the virus. HIV is primarily transmitted through specific body fluids, including blood, semen, vaginal fluids, rectal fluids, and breast milk. Here are the key methods of preventing HIV transmission. First, practice safe sex. Consistent and correct use of condoms during sexual intercourse can greatly reduce the risk of HIV transmission. Condoms act as a barrier, preventing the exchange of body fluids that can contain the virus. Second is HIV testing and treatment. Regular HIV testing is essential for early detection. Knowing one's HIV status allows individuals to seek appropriate care and take necessary precautions to protect themselves and their partners. Third would be needle and syringe programs. Intravenous drug use is another route of HIV transmission. Providing clean needles and syringes through harm reduction programs can help reduce the risk of infection among people who inject drugs. Next is education and awareness. Comprehensive sex education and awareness campaigns play a crucial role in informing the public about HIV transmission, prevention methods, and risk reduction. Lastly, promoting access to health care. Improving access to health care, including HIV testing, treatment, and counseling services, ensures that individuals can receive timely care and support. Third would be needle and syringe programs. Intravenous drug use is another route of HIV transmission. Providing clean needles and syringes through harm reduction programs can help reduce the risk of infection among people who inject drugs. Next is education and awareness. Comprehensive sex education and awareness campaigns play a crucial role in informing the public about HIV transmission, prevention methods, and risk reduction.
There is no cure for HIV, but you can control it with HIV treatment. HIV treatment, antiretroviral therapy or ART, involves taking medicine as prescribed by a healthcare provider. This involves taking a combination of medications known as antiretroviral drugs. These drugs work by suppressing the replication of the virus in the body, reducing its ability to cause damage to the immune system. ART is highly effective at controlling HIV and can prevent the progression of the virus to AIDS, acquired immunodeficiency syndrome, the advanced stage of HIV infection.
Now let's proceed to the prognosis of HIV. With proper medical care and treatment, the prognosis for individuals living with HIV has significantly improved over the years. Here's a step-by-step overview of the HIV prognosis. First is HIV transmission. HIV is primarily transmitted through unprotected sexual contact with an infected person, sharing contaminated needles or syringes, or from mother to child during childbirth or breastfeeding. Second is acute HIV infection. After exposure to the virus, a person may experience an acute HIV infection phase, which usually occurs within 2 to 4 weeks. During this period, some individuals may experience flu-like symptoms. Next would be HIV testing and diagnosis. HIV can be detected through various tests, including antibody tests and nucleic acid tests. Early detection is crucial for timely intervention and to prevent the virus from causing severe damage to the immune system. And also monitoring. Regular monitoring of HIV viral load and CD4 cell count is essential to assess the effectiveness of ART and to ensure that the virus remains undetectable in the bloodstream. And lastly is long-term outlook. With early diagnosis and adherence to ART, people living with HIV can lead relatively healthy lives. Achieving and maintaining viral suppression can significantly reduce the risk of transmitting the virus to others. It is important to note that HIV affects individuals differently, and the prognosis can vary depending on factors such as age, overall health, access to health care, and adherence to treatment. Last topic that we will going to talk about is the health teaching. HIV health teaching is an essential component of HIV prevention and management. Consider the following examples in conducting health teaching. First is discuss the primary modes of HIV transmission. This includes how the HIV virus was being transmitted and the overall knowledge to be imparted. Encourage regular HIV testing, particularly for individuals engaging in behaviors that may put them at risk for HIV infection. And educate individuals on various prevention strategies, such as practicing safer sex, including consistent and correct condom use, reducing the number of sexual partners. And that would be all. See you again on my next video. Thank you for watching. Live Jesus in our hearts, forever.